afternoon. My name is Bob Hundle. I'm CTO at Kinsey, and I'm here to present SwiftCare, a revolutionary digital transformation for healthcare. Healthcare runs on data. It needs to be made available accurately and in an agile fashion. This actually applies to all areas of healthcare, primary, secondary, and tertiary. We're also very much involved in occupational healthcare as well. The major challenges around healthcare data systems are, majority of them are very old legacy-based technologies that have been in situ for many, many years. It's very complex technology, very proprietary, makes change and flexibility very difficult. We have to solve these problems, and we have to unlock data-driven insights to improve healthcare and improve savings and also faster patient care response times. So we developed a platform that is a combination of several different applications that come together in a single platform. We've got MediLog, which is a clinical information management system, and we've coupled that with MediView, which is remote patient monitoring, and other areas of occupational health around MediWork. All of these applications come together to deliver a single platform to support patient care across the various healthcare sectors, from primary all the way through to secondary, tertiary, and occupational health. The key benefits for SwiftCare and the MediLog applications and the platform as a whole is precise tailoring. In many instances, systems change the way users do their work. This implies user behavior change and process change. We try to tailor our solution to fit with the patient and the clinical workflow that doesn't require change, doesn't require training, and enables easy adoption of clinical data management systems. This allows us to grow the platform and improves integration and collaboration between clinicians and data management staff who need to be able to support and cost effectively develop new features and functionalities for patient care. Our ambition is to be the Lego of digital transformation, is to basically be the go-to partner. And this allows us to be able to disrupt and lead on certain areas within healthcare, especially those that are unmet and underserved by large legacy monolithic platforms. We try and align very closely with industry expectations. So we design our solution with the person in mind, and this very much maps to patient-centric data care that's recommended by Gartner. Equally, relative data in standardized structured fashion. This allows for us to optimize and orchestrate businesses and clinical workflows. As long as we know the way the data is collected, the way it's stored and presented, it allows us to very efficiently use it in clinical workflows. It enables the teams to keep data at the right data at the right time, keep data in motion, and real-time event-driven data supports even more flexibility in workflows and processes. It enhances collaboration and sharing. It's a key function that has been lacking in many legacy systems, where a very static, proprietary-based business logic is tied very closely to the data, and what we are trying to do is decouple that. It allows us to remove artificially imposed silos and therefore restricting the flexibility with modern innovation for patient care. We are a cloud-first, mobile-first, library-first application. We are born in the cloud, and therefore it allows us to use the latest technologies to continue to innovate and move forward. We have a significant customer base. We are currently deployed across multiple NHS trusts and hospitals, everything from acute pediatric transport services, where the teams collect very acute, very ill, critically ill children from a regional hospital, put them into an intensive care unit on wheels, in an ambulance, and then transfer and transport those children to specialist care units. Just that logistical process involves something like 300 different distinct data points to be collected. And you can imagine the governance process around that to ensure that the patient was collected and the vital signs at that point in time, all the vital signs during the transport, and then the vital signs upon the destination. We basically cover something like 80% of the acute transport services in the UK, and our application basically allows them to very efficiently and easily capture the 300 very complex data points they need to capture for this operation. We've also enabled teams in Birmingham Hospital to deploy new services that allow for tertiary care providers to call and provide like a help desk functionality by easily developing forms within Medilog that allow them to collect the data they need without having to embark on large projects. This basically took us about 3 weeks for them to mobilize a service on our platform, which now serves pretty much most of the north of England and allows nurses in schools to call pediatric specialists and GPs to call pediatric specialists and have their case triaged before they need to take the children to hospital, if at all, saving parents and GPs a lot of time. We're currently deployed in about 600 other locations and have got a significant deployment base in occupational health, where NHS staff themselves are now using the service to look after their own healthcare and their own health while at work. So the solution was designed to scale in 3 different dimensions. We got feature scaling, which allows us to improve and add new features as quickly as possible. Vertical scaling, which allows us to move into other areas of healthcare. So our data models are very flexible. So allows us to move from one healthcare specialism to another and allows us to re-engineer the data model to support the data collection required for that particular specialism or clinical pathway. And engine scaling basically allows us to then deploy the technology that we've built into other verticals, because most of them all have a very, very similar problem. It's about having a flexible data model, being able to accommodate data changes and process changes in a very flexible and easy and efficient manner. So a lot of this is supported by a very robust tool chain, process, and governance. This has allowed us to obviously introduce event-driven architecture and services from Solace, which makes the whole platform all cloud native, and the adoption of Solace within our tool chain as a cloud event-driven engine. Moving on to the event-driven side of things, one of the challenges a lot of the traditional systems in healthcare have is this tight coupling of data, business processes in a single platform, where the business logic and orchestration of data and business processes are all done in a very proprietary programming languages. And this was the challenge that we wanted to move away from. So event-driven architecture actually allows us to do that. It allows us to decompose and separate and decouple the data from the actual business logic, and then allows us to have this infinite scalability of decomposed functions, the right data at the right time. It allows clinicians, informatic clinicians, people who are a little bit more advanced around data management, to start to develop their own business logic in platforms like Azure Functions, Logic Apps, and to be able to receive data in real time so that they can take insightful actions based upon the logic that they've written. So we don't want to be the bottleneck for clinical innovation. We want to be able to provide the data that's collected, that's processed, and give it to the clinicians as quickly as possible. And we want to remove the friction and become a frictionless platform that allows further integration with other areas of healthcare. Again, keeping data in motion and making it available at the right place at the right time. Historical traditional approaches, as we've talked about, are very much centered around clinical information systems, healthcare workers, and patients, with consultants talking to the healthcare worker to provide the patient care. We needed to improve processing And as we move forward, those clinical information systems, although they move to the center, they don't necessarily bring the data in motion capabilities. But we want to be able to support and increase the connectivity between everybody that's involved in the clinical process. So every part of the process needs to be able to receive the right piece of data that's needed for them to be able to take action. This slide provides an insight to how the data chain and data processing can be done, and the collaboration that's required within all the stakeholders and participants within clinical healthcare. So event-driven has enabled us to do what? Basically, we can now bring real-time data from IoT patient monitors in real time over the air from public spaces, like an ambulance traveling at 40 miles per hour from hospital A to hospital B. We're able to present those clinical data points and patient vitals in a web application, and then take action on those vitals being observed by a clinician that may not be within that ambulance itself. We're also able to then automatically and in real time record the same patient vitals within a clinical record to ensure that there is the history and governance required around the patient vitals as that transport was done. Traditional systems based on paper would have recorded those patient vitals, then they would have had to transfer them into a flow sheet on a legacy system once they get to the destination hospital. So there's absolutely no insight during the journey itself. And event-driven architecture effectively allows us to observe all the data that is currently being either entered, generated, or processed, and allows us to develop services that can consume that data and subscribe to that data at any particular point in time, and really provide the necessary upstream or downstream activities that will support better patient care. It's been a real change for us. And as a small company trying to deal with a very large ecosystem of traditional systems and a very complex domain like healthcare, event-driven architecture powered by Solace has really allowed a small team like ourselves to basically leapfrog a lot of the traditional systems and provide capacity and capability to clinical informatics experts to really start taking real-time actions on data that is being generated while during patient care. So real-time enterprise is driven by data that is always in motion, reacting to events as they happen and transforming them into actionable insights. That's effectively what event-driven architecture has allowed us to do. And it's allowed us to do that in a very critical domain of patient care. And it's allowed us to do that very quickly, cost-effectively, and fundamentally give that transforming capabilities to clinicians, something that the clinicians never had before. So that's one of our visions that's now been successfully delivered through event-driven architecture. Thank you.